Hey folks, this is Michelle Allman, CEO and company cheerleader for Clear Digital Media. Today, we're going to do a quick little tip, information, insight on patient-centered care. So what I'm going to do, there are 7 elements of patient-centered care as defined by the Picker Institute. And we're going to talk about the first 3 today. And then we're going to follow up with the rest of these very important aspects of providing top quality and best practice care for your patients. So let's start with this. What is patient-centered care? Well, patient-centered care really does equal differentiation and growth for your practice. The difference between patient-centered care and what we'd call the in-clinic experience is that there actually is no difference. They're one and the same. It is patient-centered care is really a component of that in-clinic experience and vice versa. So the in-clinic experience really is elements of patient-centered care, and you'll see what I mean as I get into this. So there are 7 dimensions of patient-centered care, as I mentioned, and one of those things that we're going to start with the first 3. So number 1 is respect for patients' values, preferences, and expressed needs. Well, what does that mean? That means that you want to involve your patients in all the decision making, recognizing that every patient is an individual with their own unique sets of values. They have preferences, they have desires. So it's a matter of identifying each one of your patients as individuals. And one of the things we're going to be doing in a follow-up newsletter, which we hope you're subscribing to and reading, is we're going to be talking about how to create patient personas. And this is really how you identify the uniqueness of each one of your patients, identifying their values and the things that are important to them and how they process information. And it seems like it's like, well, I got a lot of patients, that could take a lot of time. What we'll teach you how to do is how to chunk that up and how to create these personas that really define a cohort of your patients, and it allows you to better address them as individuals throughout the care process. So this is an important component of patient-centered care. It's about treating patients with dignity, respect, with sensitivity to each one of your patients' individual cultural sensitivities and how they process information, as I mentioned. So number 1, again, respect for the patient's values, preferences, and expressed needs. That's number 1. Number 2 is the coordination and integration of care. What does that mean? Well, when patients were questioned in focus groups, one of the things they expressed is feeling really vulnerable and powerless in the face of illness or a disability or something that's going on that they don't know how to define in their bodies. So the proper coordination of care can alleviate those feelings. Patients identified 3 areas of coordination of care that really matter to them and where they feel the most vulnerable. And that includes the coordination of clinical care, the coordination of ancillary and support services, so that treatment plan, that follow-up care, and then the coordination of frontline patient care. We know how important that front line is. We know how important that front desk staff is. So patients mirror that understanding, that it is super important in coordinating those 3 elements of care to remove the feeling of vulnerability for your patients. And number 3 is information and education. This is super important for patients and patient-centered care. Also in interviews, patients expressed that their worries were not being completely identified, addressed when it came to prognosis and their condition and the treatment plan. And this is a perception of the patients, and it's super important that we do acknowledge and understand their perceptions, because the perception of certainty is where patients will adhere to treatment plans post-diagnosis and post-appointment. So these are important. To counter this fear, some of the things that we can do as providers is information on clinical status, progress, and prognosis. So it's that follow-up, keeping patients advised and aware of what their condition is, what the prognosis is, what the treatment is, how important adherence to the treatment plan is. These are all things that help to alleviate that fear, that worry that they're not completely informed. Number 2 is information on the processes of care. So what's next? What are you doing? Why are you doing this? Why should I be adhering to this treatment plan? What difference does it make for me? So that kind of information is important. And information to facilitate autonomy, self-care, and health promotion. This is something I think that often is missed, and as a patient myself going to a doctor, it is something that I think is not addressed consistently, and that is giving patients the tools and the information to care for themselves and to ensure that they have the information to promote good health. And I think a lot of times we're super overwhelmed with a lot of information, and there's different tools that we'll be sharing coming up that you can implement in your practice that actually take that ball and run with it, that we can automate that information process. We can automate the education process. So we're going to talk about that in the future. So stay tuned. Thank you so much for watching. Please hit subscribe, like this video, and share it if you think this information was valuable. We really appreciate it. And by all means, please give us comments. Let us know what else you'd like to learn about as we move forward in sharing more information. Thanks so much for watching. We'll talk to you soon. Bye.